Dr. Garcia embodies compassion and humanism like no one I have seen in my 3 decades of providing care.
Stepping into the job about 30 years ago as the medical director for homeless services in Worcester, we were really the only ones doing primary care for people experiencing homelessness with HIV, getting involved with women's health issues and safety and care, HIV care, trauma-informed care, caring for people who suffer from major mental illness, and finally, caring for people who are just frankly used to not necessarily receiving care. We're taking care of people ranging from age 19 to their 70s. The people we care for come from so many backgrounds. And so when you have to have a brief visit with somebody, it's really difficult sometimes to help make the connection that really needs to take place. It takes months, sometimes years, to build a trusting relationship with a patient so they understand that you have no secondary gain here other than to help them be in a better place.
He makes our nurses and medical assistants and peer recovery coaches feel good about themselves. He honors them with praise, sometimes with flowers, and with kind words. He knows the power of positive reaffirmations to keep the team going.
One of the things that we really strive to do is focus on others. Just give your attention, just give a moment, and sometimes that makes all the difference. And to try to do that and at the same time be respectful of the fact that there are people waiting outside of your van in the rain sometimes, in the winter sometimes, just to be seen. I have a lot of respect for anybody who's willing to make that wait just so that they can receive care. Often we find ourselves just trying to meet those needs and to give a smiling face, something to eat or drink, something to help people understand that, we're here for them, and humanizes yourself to somebody who may look at this hierarchy of here's the doctor and here I am. We try to remove that hierarchy. There's a lesson here, and the lesson is you never know what's going to make a difference. You have no idea what the effect down the road can be of even a little bit of kindness, even a word of support. And the best way to do that is just to be a person and to be sometimes a little vulnerable.
Zing has a unique ability to meet suffering with deep compassion, and he has impacted innumerable lives.
Social work is not a glamorous profession. However, when you put purpose to what you do on a daily basis, I find that it's very rewarding. I took this job 25 years ago here at Shirley Ryan Ability Lab, and admiring the compassionate caregiving that they provide helps me to be inspired each day that I come to work, and that's what sustains me daily. As a social worker, I help our patient and family members to adjust to their current disability. Processes can be complex and difficult to make arrangement for the services that they need to meet their current disability.
Through his attentive listening and clear communication, he always creates a therapeutic environment where patients and families feel understood, respected, and cared for.
To me, compassion is not a relationship between the healer and the wounded. It is a relationship of equals. Doing this job is a direct outflow of who I am and also the legacy of my life. I think we all strive for connections. That shared humanity helps reduce the isolation. So I think by providing that compassion in that relationship, I think it helps with build that connection that we all yearn for. For the last 25 years, every day I walk through the front door, I recognize that this is important work, a place where I can actually make a difference in someone's life on a daily basis and have a sense of gratefulness when I leave here at the end of the day, that it's a good day if I had made one life better.
Seeing Sylvia in a family meeting is like watching a guardian angel offering solace and inspiration in equal measure.
Geriatrics has always been my passion. Being Comanche Indian, I relish being in the presence of, in my culture, elders. And I think that is the root, for me, of what I do with my patients, is I want to know them. I want to know them as people. And I've learned so much from them. Just their life experience, they're just amazing, amazing people. And they have so much to offer if we just sat down with them. What I need is sincerity, empathy, compassion. That patient is going to get that from me. We all can do that. I never stand over my patients. I'm always kneeling beside them. I'm sitting beside them. I'm equal with them. It is being present. And it is so important that that be my focus. And I think even this award, to have other people write about me in the manner in which they wrote, I never thought people were looking, because I just focused on my patients. And yet, as evidenced by colleagues of mine who have just said the most amazing things from what they saw, and that, to me, is incredibly validating. It's important because this population of people are the forgotten. I can laugh with my patients. I can cry with them. Providers feel, oh, I shouldn't cry. I cry with my patients all the time.
The joy Sylvia brings goes beyond medicine. The connection she creates through her unique presence with patients, families, and coworkers invite everyone she works with into this higher level of care.
I love my patients. I think sometimes there's a little bit of weariness about loving your patients. I love them. I love what I do. I love what I do. I love the privilege and the honor of being present with my patients.